Hi, Miss Tolios. My name is Kayla. I'm going to be your student nurse today. I'm just going to be here to kind of look you over, make sure everything's running okay, and kind of get a quick bedside assessment. Can I see your armband? Can you give me your name and date of birth?
Kaylee Tolios, 5/27/99.
Beautiful. Are you in any pain today?
Nope.
Everything feeling okay?
Yeah.
All right, so I'm just going to make sure everything looks good, sounds good, and then I'll be out of your hair. Do anything fun today?
No, just here.
Kind of a rainy day out, so.
Yeah.
Alrighty, so do you know where you are?
The hospital.
Do you know what hospital?
University of New England's hospital.
Beautiful. Do you know who you are?
I'm Kaylee Tolios.
Do you know what year it is?
2019.
Awesome, so you're alert and oriented, which is great. I don't see any drooping, anything like that. Your speech seems great. I'm just gonna check to make sure that your pupils and everything are good. So if you could just give me a look up at the ceiling for me, that'd be great. Alrighty, so your pupils are equal, round, responsive to light. And then can you just look back, sit back for me, and then follow this in? Awesome, so they're also accommodated, which is great. I'm just gonna put this down. Alright, so now I'm just gonna give your heart a listen if that's okay. Is it alright if I go under your shirt?
Yeah.
Okay. Alrighty. Just gonna stick this under. Sorry about that. Alrighty, so I noted your S1 and S2, which is great. Everything else seems good. I don't hear any gallops, murmurs, or rubs, so that's awesome. So if you just give me your fingers, I'm just going to check your cap refill real quick. Just make sure that's okay. Awesome, so it's under 3 seconds, which is great, so that means your circulation is going good. I'm just going to feel your pulses. Awesome, so they're equal bilaterally, which is also good. And then I'm just going to give your pulses down here a feel. Also feeling these equal bilaterally, so that's awesome. And then I'm just going to feel up here, make sure that you have pedal pulses as well, which I'm feeling, and they're both equal and bilateral, so that's great. I'm also just going to check to make sure you don't have any edema. Do you notice any swelling of your legs at all?
No.
Awesome, I don't see any, so that's awesome. So we're not noting any edema. Alrighty, so then now I'm just gonna listen to your lungs if that's okay. Make sure everything's working down up in there. Okay, I'm also gonna go under your shirt for this one, is that okay?
Yep.
Awesome. Deep breath in for me. Deep breath in. Deep breath in. You're just going to go under your shirt for this one. Deep breath in. And one more time. Awesome. I'm just going to have you sit up on the edge of the bed for me if that's okay. You feel comfortable at this height, or would you like me to lower it? Okay. So, I'm just going to go under the shirt again for this one if that's okay. Sorry. All right, deep breath in every time my stethoscope hits your chest. I'm going to go under now. Awesome, so you sound clear. There's no laboring or anything like that. I'm not hearing any wheezing or crackles, so that's great. Do you want to just lay back for me? Do you have a cough at all?
No.
So you're not coughing up any like mucus or anything like that? Awesome, that's great. So now I'm just gonna do an inspection of your abdomen. So do you mind if I pull up your shirt and just like look at it? Okay. So it's looking great. I'm just gonna give it a listen if that's okay. Awesome. So I hear bowel sounds in all 4 quadrants, which is great. They sound really normal active, which just means that you have bowel sounds everywhere and everything's moving smoothly. So now I'm just going to feel and make sure that there's no tenderness in any section. Does that hurt at all?
No.
What about here? Anything here?
No.
Anything here?
No.
Awesome. Are you tolerating your diet okay? Any nausea, vomiting, diarrhea? When was your last bowel movement?
This morning.
Was it normal for you? Like good color, good shape, everything like that? Okay, not too liquidy or anything? Perfect. When was the last time you urinated?
Maybe an hour ago.
An hour ago? Was it clear? Was it darker in color?
Clear.
Did you have a decent amount that you usually have? Anything abnormal?
No.
Awesome. So I'm just going to feel and make sure that your bladder isn't distended, which I'm not feeling anything, so that's great. So keep up the hydration. That's awesome. Now I'm just going to move on to a couple range of motion exercises, make sure everything's functioning properly. So do you mind looking all the way this way for me? And now all the way back. Perfect. Do you mind nodding your head all the way to your chest? And then all the way back. Okay. And I'm going to have you move your arm all the way up as far as you can go. And then back down. I'm going to have you move it out to the side as far as you can go. And back in. And I'm going to have you lift at the, crease at the elbow. And then back down. And I'm going to have you take your wrist and go in circular motions. And now touch each of your fingers to your thumb. Beautiful. I'm going to have you do the same thing with the other side. Do you want me to move the bed rail down for you?
Sure.
Okay, so just move this one up. Alrighty, so I'm going to have you go back again and all the way back forward. And then all the way out for me, back in, bend at the elbow and back down, wrist and fingers. Look at that. Awesome. So then while I'm here, I'm just going to have you take both my fingers and give them a squeeze. So you have strength on both sides, and it seems like it's equal, so that's great. And now I'm going to have you bend your knee up all the way and then back down. I'm going to see if you can bring it out as far as you can on this side and back in. I'm going to have you roll your ankles for me and then flex down, flex up. All right. I'm going to have you push up against me for strength and push back down. Beautiful. Push up against and then push back down. And I'm going to do the same thing on this side. So I'm just going to take your arm, push up for me, and then push down for me. Beautiful. So now I'm just going to do your leg on that other side. All right. So I'm going to have you move your leg all the way out for me and back in. I'm going to have you bend at the knee and back down. Roll your ankles for me. Dorsiflex, down, and then back up. Beautiful. So it looks like your range of motion is really good. Your strength is great, equal on both sides. You look like everything's great, no swelling. When I touch your skin, it seems like it's warm to the touch, so that's great. I don't see any dry skin. It looks like you don't have any swelling, which is also really good. Do you have any wounds that you have noticed? Any open cuts, anything like that? All right, and then I'm just going to do one more thing. I'm just going to check to make sure that you're hydrated. So I'm just going to pinch up here. And it bounces right down, so that's great. So keep up that hydration. It seems like you're getting plenty of fluid in. Do you have any other concerns?
I don't think so.
Anything else going on that you want to talk about before I head out? Anything I can do for you?
No.
Alrighty then, I'm going to put your bed back down. I'm going to give you the call light. If you need anything, just give me a call and one of us will be right in.
Thank you.
You're welcome. Alrighty, you have a great rest of your day.
Thank you too.